So my name is Calvin Wallace. I'm an obstetrician gynecologist. My position is as a provider, meaning I give care to women throughout all phases of their life. I also serve as an administrator, a medical director of women's services for the health system that I work for.
And what made you want to be a doctor and why? And particularly the position you work in.
Well, I decided I wanted to become a physician. By the time I was a freshman or a sophomore in high school, I had made my decision that that was going to be my goal. I think a lot of the people that I was friends with on my swim team and Boy Scouts, a lot of their fathers were and mothers were physicians, and so I was exposed to what doctors do at a young age, and I decided that's really was a good fit for me.
How would you describe kind of a day in your usual work life?
Well, I think I have a pretty busy work week. During the week, each day typically is different. Some days I spend the entire day in the clinic and can see up to 25 people. The next day, I may be in the operating suite and I can do up to 7 surgeries. And then the following day, I can be based in the maternity floor. My week is a mix of all three of those work scenarios.
You took a leadership role within your hospital because you were originally just an OB, right? And then you added the role. When did that happen and what does that consist of compared to what your old work schedule was like before?
Well, I've been in practice for more than 25 years, and I've always served on various committees for all the hospitals that I've worked at. And eventually I took on leadership roles as the chairman of various committees for quality and for review and for policy setting. And then I went on to become a department chairman. And then about 4 years ago, I was asked to be the medical director for the entire service line for the health system that I work for.
What is the hardest thing about the COVID pandemic in terms of what you had to change or just your work life in general?
So the hardest thing really is just finding ways to keep everyone safe. Patients want to know that if they come into the clinics or the hospitals, that they're going to be safe, that they're not going to be exposed to the virus. At the same time, employees and providers that work in the clinics and the hospitals want to know that they're going to be safe and that they aren't going to be, at a high risk for contracting the virus.
So, what are some of the things you put in place to make people feel safer?
Well, many of the things that were also done in other workplaces. So, mask wearing, that includes patients and employees and providers coming into the facility. Everyone has to wear a mask. Social distancing has also been a major focus in terms of how we keep people safe. In the past, we've had as many as, each provider would have as many as 20, 25 people, coming through the clinics, which could lead to crowded waiting rooms. Well, we've had to institute measures to try to keep as few people in the waiting rooms as possible. So we've set up virtual visits where we, have visits just like this using social media. Sometimes we'll have people, wait in their cars instead of the waiting room, and then we'll text or call them when it's time for their appointment. So we've instituted a lot of measures to keep people safe.
Have people been receiving that well, or has it been kind of a mixed batch? Some people don't want to use the internet or things like that.
So most people have adapted well to all the measures we've instituted. I think people understand why we're doing it, and they want to feel safe themselves. But there have been some struggles. Not everyone is comfortable with technology, and so some people have had trouble sort of negotiating the various technology platforms that we use. Some people aren't comfortable wearing masks and either don't feel it's necessary to wear a mask or don't want to wear the mask properly, protect others. But for the most part, everyone really has embraced all the measures that we've instituted.
What was your biggest fear when you knew how serious the COVID pandemic was going to be?
Well, I had a lot of fears, but I got to admit, one of the biggest was because I was a healthcare provider and I definitely was going to be around people who had the COVID virus, caring for them. Would I bring this virus home and expose my family to the virus? And so, what could I do to protect, my family? Was always a big fear.
And what is the biggest thing you've learned throughout this experience?
That people, healthcare workers especially, are very resilient. Throughout all of this, everyone has come to work and done their job, despite the increased risks. We have receptionists that are exposed to people every day at a close distance. We have nurses, we have providers, but through it all, everyone has still come to work because they realize the importance of the work we do and that everyone needs healthcare, and they want to be there to provide that care.
What is the most memorable work experience that you've had during the pandemic period, and why was it memorable?
Well, I've worked with several employees and providers who have contracted the COVID virus. To see them come back to work relatively healthy, some 2 weeks later, some many, many weeks later. Those are always very memorable and happy moments to see that someone has worked through this and come through healthy.
What do you feel like your purpose is as a doctor? It's a pretty broad question. You talked about earlier the importance of your work. Yeah, what do you personally get out of it, or what do you feel like your purpose is?
My purpose is to deliver health care. When people have needs, to help them through their needs. And in this pandemic, the purpose has become even broader. Despite the risks, I still want to provide health care while at the same time keeping them safe, keeping all the employees safe, keeping providers safe.
This is just a question more specifically about your profession in regards to you specialize in babies and pregnant women. So, how do you kind of treat them differently when they've both contracted the virus? Like a pregnant woman who just had given birth versus like a newborn baby.
We've taken care of many women who have contracted the COVID-19 virus during their pregnancy. We're not quite sure yet whether babies actually come down sick with the virus. I think we need more information as to what the real risk to the baby is. But we've taken measures to protect babies that are born to COVID-19 positive moms. We teach the mothers about masking, hand washing, all the measures that they need to do to protect their babies. We also offer moms the ability to isolate the baby and keep the baby in the newborn nursery while the mother is recovering from the COVID-19 virus. So mothers have options. They can isolate from the baby for a short period of time until they're feeling better, or they can continue to care for the baby, and we'll teach them how to protect the baby from themselves.
What do people usually do?
I think most people are choosing to continue to care for their baby.
Where do you think our country specifically and then the world in general will be a year from now in terms of the virus?
I think a year from now, the virus will still be here. I think that there will probably be an effective vaccine, but my hope is that everyone will have access to the vaccine. I think this virus is similar to the flu virus in that you may have to develop a new vaccine each year to protect people. I think that a year from now, we'll have developed a vaccine and we will be well on our way to learning how to efficiently produce these vaccines so that we can produce them year after year after year.
In terms of the American medical system or American hospitals, what do you think that our biggest flaw is?
I wish that everyone has access to health care, no matter what their ability to pay. So that is a flaw in our system right now, because there are disparities in whether you can receive health care and the level of health care that you can receive based on your ability to pay. It's just important that everyone be able to receive the same quality, same level of health care, no matter what your ability to pay, what your background is. Everyone deserves high quality medical care.